Aloha! I am pleased to have Dr. Cassandra Peterson here with me today. She is a chiropractor that specializes in children and adults with behavioral, learning, and socialization challenges. Since autism is my medical specialty, I'm excited to introduce our viewers to a unique approach that has been shown to also help successfully treat the condition. Autism is considered a neurological disorder because of the way it affects the brain and nervous system, but that label may not be altogether correct. It would be more accurate to think of autism as a multi-system disorder frequently arising in the gut and then acted out in behavior. But the same also applies to ADHD, learning disabilities, and even psychological conditions like anxiety, depression, and OCD. So it's the biological processes that I treat medically, addressing problems with the gut, immune system, and more. Dr. Peterson is here to share some unique therapies that help the brain and the nervous system in ways that are different from but work very well in conjunction with the medical treatments that I do. She's seen a lot of problems in kids today. There are rising rates of learning and developmental challenges, including autism, ADHD, and learning disabilities. We're also seeing emotional dysfunction, attention and focus issues, anxiety, sleep problems, defiance, and social struggles. So, Dr. Peterson, welcome. Thank you so much for being here with us today.
Thank you so much for having me, Dr. Taketa-Wong.
Yeah.
Across Hawaii and beyond, more families are seeing focus, sleep, anxiety, and social struggles. Sometimes these struggles have a diagnosis, and sometimes they don't. I look at these struggles through a brain-based lens, because here's the truth. There are no bad kids and no broken kids. Behavior is a window into the brain, and there's always a reason for every behavior. My job is to help uncover why a child is struggling and support the brain and body so that they can thrive.
Yeah, I completely agree. And it's so true that, it really is that there are underlying things that are going on that make it difficult, right, for our kids to be able to thrive and be able to do well. And I think so treating the underlying causes is so important. So I think a common question people might ask, well, why is a chiropractor talking about brain development?
Yeah, so when people hear the word chiropractic, they often think neck cracking and back pain. But what I do with kids is different. It's gentle, very specific, no twisting. We're looking at neurostructural shifts, or what are traditionally known as subluxations. When the spine gets stuck, it can change the way that the spinal cord is functioning underneath it. And in fact, it can change the way that the brain is receiving messages from that area of the body or outside the body, which is a really big deal because if the brain isn't receiving messages appropriately about what's happening out here up this way, and it doesn't know how to process appropriately, and it doesn't know how to send appropriate information out, then that's a big problem. Neurostructural shifting also pushes our nervous system into fight or flight, and we're going to talk about that. So there's really a lot of specific tests that we can do as chiropractors. Functional brain-based testing to check different parts of the brain, neurological tests, range of motion checks, and we have different reflex checks to see if neurostructural shifting is present. And kids rely on a clear brain-body communication to regulate emotions, pay attention, and learn. So chiropractic isn't the whole puzzle, but it's a key piece of helping kids develop in a healthier way.
Yeah, and I've definitely seen kids, I refer out to chiropractors all the time because I've really seen how, aligning things structurally can make a big impact on things that people don't traditionally think about with chiropractic, like with the brain function and with mood and even digestion things. So can you just briefly explain your approach that you take with helping these kids?
Yeah, sure. So I am a certified Brain Blossom program provider. So the program is a multidisciplinary approach involving functional neurology, neuro-based chiropractic, gut healing and nutrition, genetic and epigenetic work, integration of primitive reflexes, looking at metabolic issues, and cognitive games and exercises to retrain the brain. So the first step of the program is the neuro-based chiropractic care. I think we can all agree that we have more stress in this day and age than our parents or our grandparents did. Too much screen time, not enough movement, less nutrition in our food, chemicals and everything. And those are just some of the stresses that kids are experiencing in the here and now. So let's play a little game to imagine what that stress feels like. let's pretend we're walking through the woods with our family and we're having a nice day, and all of a sudden a bear jumps out at you. Like, what do you feel? What does your body do? Would that be a good time to, say, learn long division or fight off a bacteria? Can you imagine being in that state all the time? Kids who struggle are living in constant fight or flight. This is why getting adjusted to regulate the balance of the nervous system is so important. So that's step one. Step two is gut healing and nutrition. Changes in the lining of the gut change the diversity of the bacteria in the gut, which changes the chemicals in the gut, which changes the communication with the brain. Gut-brain connection is very important. The gut is the second brain. So we do food sensitivity testing to figure out which foods to eliminate in order to decrease inflammation in the gut, which then decreases inflammation in the brain. Step 1 and 2 are what we call tilling the soil. Because when we have a balanced nervous system and we fix the inflammation in the gut, we then have a brain that is now ready for growth, learning, and healing. Step 3 is a brain retraining program with body movements, eye movements, cognitive games and exercises, and integrative visual learning that parents can access on an app and do at home, no more than 5 minutes a day, 3 to 5 days a week. And the exercises are designed to systematically work the brain, starting in the lower brain or brain stem, with increasing levels of complexity to challenge the brain. And then step 4 is simply parental support. We teach them how to change their lens on how to look at behaviors, as well as giving them right now strategies to implement into daily life. So essentially, in every single case that comes to me, we have to ask and answer the 2 big questions. Number 1, is there anything altering the way that the brain is receiving, processing, and sending information? Number 2, what tools is the individual using to process, engage, and connect to their world? So let me explain that. We know that the brain is not fully developed at birth. We know that there's a certain order to the stages a brain must go through for normal development. And this is why hitting milestones is so important. We call this the hierarchy of brain development. We know that a newborn baby uses different tools to find food than an adult. A newborn baby, we stroke their cheek and they're going to turn. It's not very sophisticated, but it works for a baby. So the way a 1-year-old finds food is also going to be different. They're going to move through space and crawl to their food. A 4-year-old is just going to ask for food, and an adult is going to visualize the food in their mind's eye and use these other tools to get to the fridge and get their food. So between, one second. A baby explores their world by moving around and touching things and putting things in their mouth because there's a lot of and that's how they learn about the world. So then between the ages of about 2 and 4, the next sharpest tool, and it doesn't mean that we're not using the ones that came before, but the next sharpest tool is auditory verbalization. You're making sounds at me and I'm starting to make noises back at you. It doesn't start out as sophisticated language. We have to build up to that. And then between about the ages of 5 to 7, the most sophisticated tool, which comes from whole brain development, pushing all the way up to this prefrontal cortex, is visual cognition, being able to hold an image in your mind's eye. And I'm not talking about vision. It's being able to imagine the past and the future. It's the seat of executive function, organization, and planning, and social and spatial awareness. So if kids or adults are not using this most sophisticated tool that a human can have, if they are using less efficient tools like auditory verbalization, we are going to see that in their behavior. And a kid who is processing in an auditory verbal way might look like someone with verbal tics, humming, making animal noises, or trouble concentrating in background noise or loud environments. If they're using less efficient tools like movement touch, we are going to see what looks like hyperactivity and things like sucking on their shirt, picking scabs, and inappropriate touching. If a person is struggling with being in shutdown mode or has lots of tummy aches, rigidity, or tears, we're probably going to find some retained primitive reflexes on the functional brain-based exam. So we're starting kids in activities younger and younger, and we're putting more demand on them, and the tools in their toolbox might not be enough to meet the demands. So when developmental readiness doesn't match the demand, we are always going to see avoidant behavior, which soon leads to being labeled as a bad kid. So instead of covering up those behaviors, we need to understand them. And once we've tilled the soil, we can then focus on filling the gaps in development to sharpen the tools that need sharpening.
Yeah, thank you. That's fascinating. And I think in a little bit you're going to share some case histories with us. I think that'll give people kind of a better idea to kind of see like how it actually looks, when it's getting put into practice. But for our viewers first, if you want to contact Dr. Peterson to learn more about the work she does, please check out her website at mamabearchiro.com. We have a link in the post. And if you would like to talk with me about any health concerns, you can call or text our office to schedule a free of charge phone consultation with me. I am a naturopathic doctor, and so that's a medical specialty that combines the cutting edge science and traditional healing remedies. So we use the science to diagnose and the remedies to heal. And that empowers us to replace pharmaceutical drugs, unless absolutely called for, with healthy foods, vitamins, minerals, medicinal herbs, supplements. And then the doctors in my practice and I are also trained in acupuncture and Chinese medicine, which gives us two powerful additional medical tools. And we always want to make sure what we do fits your needs, so you can find all the contact information on our Facebook page. So getting back to our discussion with Dr. Peterson, so can you share with us some stories of patients you've helped using the treatments that you discussed?
Yeah, absolutely. One family came in completely overwhelmed. Their son had an autism diagnosis and was also explosive. Big tantrums, aggression, constant meltdowns. His parents were actually considering getting a second home just to keep his other siblings safe. So when we evaluated him, we saw that his brain was stuck in fight or flight, and he was using very primitive tools to process the world. We found that he had some retained primitive reflexes, and instead of punishing behaviors, we worked on calming and regulating his brain-body connection. Sometimes that meant just turning off the lights or laying on the floor just to connect with him. We did adjustments and eliminated the foods that were stressing his gut. It wasn't until we started the primitive reflex integration exercises that we started to see the big results. 9 times out of 10, kids with explosive behavior have retained primitive reflexes. The explosions decreased dramatically, he began to communicate, and he could finally connect with his family and peers. Today, he's mainstreamed in school, and he doesn't have an autism diagnosis anymore. His parents say this work literally saved their family.
That's crazy. That's amazing. So,
super cool.
And I want to say a little bit about primitive reflexes, because we've talked about that, and I've seen therapies working on that to be really effective. But I think our viewers may not understand what primitive reflexes are. So could you, just like really briefly just explain like what primitive reflexes are, And
Yeah, so
yeah.
primitive reflexes like the Moro reflex, this is our reaction to threats. It allows us to survive as infants. So we have all kinds of different reflexes that usually start out in utero or develop in the first year of life. And by about the age of 1, most of those reflexes are supposed to be put away and integrated into our nervous system. If we don't have them put away, or if we go through them out of order, that is usually going to result in consequences in our system later on down the road. And we'll usually see that in things like handwriting issues or the big explosive behavior or things like that.
Yeah. And so when the therapies are used to address it, that can help with behavior or mood or attention focus or all these other things. Yeah. Okay, yeah, go ahead. And then you could share.
When we fill those gaps and we fix those things, the big behaviors tend to just melt away.
Mm-hmm.
So, yeah.
Yeah, I know you had another case.
Yeah, I can share the other cases. We also worked with a boy who had an ADHD diagnosis. He was really smart, but he couldn't sit still or focus. His parents said he would leave his seat in his classroom, and it was like he was being driven by a motor. Homework was a daily battle, and his doctor said medication was the only answer. So when we looked deeper, we saw that he was still relying heavily on movement and touch to process information. Tools that work for a toddler, but not really for a 7-year-old who's expected to sit still and read. So through adjustments and the brain blossom exercises, we helped his brain build more sophisticated processing tools. And now he can sit, focus, and complete schoolwork without constant redirection. The biggest change isn't just in his grades, it's in his confidence. He feels capable, and his parents say family life is much calmer and happier. And case 3, we had another child whose parents came to us after years of battling obsessive compulsive behaviors. She was stuck in cycles of rituals that consumed her day, like washing her hands until they were raw, repeating tasks over and over, and melting down if anything was out of order. So we approached it the same way, not by trying to support, but by asking, why is her brain stuck in those patterns? Her nervous system was overloaded, and her brain was relying on rigid routines to feel safe. For kids like this, when stress goes up, their need to control and predict goes up with it. So when you go to Foodland instead of Safeway, you blow up their world. I knew that she wasn't visualizing effectively. And so once we gave the parents some right now strategies, like drawing out her plans for the day as stick figures to help reduce the anxiety, and then working on her primitive reflexes in combination with visualization games, her compulsions lessened, she could tolerate flexibility, and her anxiety drops. And her parents say the biggest gift was watching her finally enjoy being a kid instead of being trapped in those rituals. So instead of hammering on removing an unwanted behavior without looking at the big picture, we need to be thinking, how can we help this child live their best expression of life? Your kids are more than the sum of their parts. They're more than their deflective behaviors. They have a path before them that is greater than being stuck in their challenges. They can engage in and learn from and connect with their world and the people around them. They can. We just have to help to understand where they are, what they're doing, and how do we fill those gaps. So if you take just like one thing away, let it be this: there are no broken kids. There are reasons behind their struggles, and there is hope. If this resonates, I'd love to connect. I'm Dr. Cassie Peterson. Please follow me on Mama Bear Chiropractic on Instagram for brain-based parenting tips. I also do a monthly talk on behavior and brain development. And I do complimentary phone consultations as well. Sometimes one conversation is all it takes to see your child in a new light. Thank you.
Yeah, thank you so much, Dr. Peterson, for joining us today. So, yeah. And where can people find the, you said you do like a monthly class?
Yeah, if they go to my website and do a contact form submission, they can ask about it and I can sign them up for the next one.
Yeah, that's great. So, yeah, so for our viewers, I trust that our discussion today has been useful for you. And so again, if you want to contact Dr. Peterson, again, you can find her at our website or on Instagram. And if you have questions for me, you can also contact our office. I also do a free of charge phone consultation if you have any questions for me, and you'll find all the contact information on our Facebook page. Please also support our work by visiting our online supplement store, which is on our website at drtaketa-wong.com. That's drtaketa-wong.com. So with a 20% across the board discount, our prices are very competitive, but the main thing is that the proceeds go to helping children with special needs with their medical treatment. So a link is in the post of this video, and mahalo. We look forward to you all in 2 weeks. So aloha, and thank you again for being with us, Dr. Peterson.
Thank you. Goodbye.